Hi, I'm Senator Ben Cardin. I'm pleased to join you today. First, I want to extend my deepest gratitude to United Way leadership, staff, and partners for your contributions to reducing economic hardship in the Central Maryland region, especially your heroic efforts since the start of COVID-19 pandemic. I am proud to represent the Baltimore region in Congress, first in the House of Representatives and now in the Senate. Time and again, I've been impressed by the breadth of community organizations, including United Way, who truly understand the needs of Maryland communities and are doing so much incredible work to meet those needs. The United Way of Central Maryland has been an effective partner in supporting the needs of our local communities. The COVID-19 pandemic has undoubtedly exposed so many existing inequities. Inaction in the face of this crisis would have set us back decades in so many measures of progress. It also has presented us with an opportunity to pass bold investments aimed at reducing inequalities and bringing all Americans to a higher standard across educational, housing, health, and economic dimensions. President Biden's first major legislative achievement, the American Rescue Plan, was one of the most significant pieces of legislation to improve the lives of low-income and vulnerable populations in decades. One of the most important pieces of this legislation was emergency rental assistance for millions of families who have fallen behind on rent during the COVID-19 pandemic. Through this provision, Maryland received nearly $318 million, which combined with funding Congress passed in December, means that Maryland has received a total of $720 million in federal assistance to help families keep a roof over their heads. This bill also included significant investments in housing choice vouchers, homelessness assistance, as well as the home energy assistance to help people keep the lights on. The American Rescue Plan also significantly expanded the child tax credit and the earned income tax credit, estimated to cut our nation's child poverty rate by as much as 1/2 by lifting as many as focus. They both recognize that investments in our caregivers is one of the only ways to create an economy that offers equal opportunity to all. From universal pre-K to free community colleges, these investments would pave the way for a strong, inclusive workforce. President Biden's plan would also continue to invest in solutions for high-quality, affordable housing, as well as investment in our nation's schools, infrastructure, and transportation policy. Finally, I am also committed to working to improve equity this year through reforming our nation's policing practices. The House-passed George Floyd Justice and Policing Act of 2021 includes my End Racial and Religious Profiling Act, which would ban discriminatory profiling by federal, state, and local enforcement nationwide. It also includes my Law Enforcement Trust and Integrity Act, which addresses the problem of police misconduct through the development of a uniform national standards and data collection. Thank you for inviting me to be part of this important conversation and for your important work dealing with systemic racism and inequalities. You recognize that exists today. Those who think we have moved beyond such things are not facing reality. It is our responsibility as lawmakers and as community leaders to not only find ways to help people overcome such barriers, but to replace these biased systems with one that acknowledges past problems, improves the lives of Marylanders, and reduces inequalities.
We are so pleased to hear of Senator Cardin's appreciation of United Way's work and that of our many partners and our other local organizations. We're also very grateful for his initiatives, as you heard, to drive equity and justice across Central Maryland. United Way will continue to work day and night to respond to the impact of the pandemic on our residents and to really improve the health and well-being of all of our citizens throughout the region. So I want to thank you all of you, for being here with us today, just to learn more about what was accomplished in this past legislative session. And also what remains to be done, as Senator Cardin said, to help hardworking families and individuals throughout our state and our region. And so our Realities of Inequity series, it really focuses on the obstacles, right? The obstacles that people in our region face to achieving economic stability and what can be done, right? What can be done to break down barriers to their success. And so every 2 years, we issue a comprehensive report that reveals exactly why so many Marylanders can't get ahead. It's called, as some of you are aware, the ALICE report. So let me begin by defining ALICE for some of you. ALICE stands for those who are asset limited, they're income constrained, but they are employed. Those who are working, but really just find it difficult to make ends meet. These are people working 1, 2, sometimes more jobs, typically those which are lower paying, like our cashiers and clerks, healthcare aides, receptionists, grocery store workers, delivery service and warehouse employees, and the list goes on. And they are essential, really, to maintaining our infrastructures and to also maintaining the operations that allow all of us on this call to navigate our lives with ease, but they can't afford the essentials like housing, food, healthcare, childcare, and transportation, or the technology that today's world absolutely demands. And you ask the question, why? Because the cost of living far outpaces what they earn. Based on 2018 data, a staggering 39% of Maryland households couldn't make ends meet. And that was then. And that number is, without a shadow of a doubt, much higher in the wake of the lingering pandemic. And so we also just issued another report based on a survey of more than 2,000 Marylanders on the impact of COVID on their lives and their livelihoods. This report compared the responses of those who are below the ALICE income threshold with those who are above this established threshold per this report. We share these reports freely with anyone, especially our elected officials, to just help increase awareness of the challenges that our ALICE households face. Challenges that really in many ways have only been amplified. They've only been enlarged by the pandemic. And before I share some of the results of our COVID survey, I'd like to ask all of you of the following. Which do you think were among the top COVID-related concerns for those who we have called ALICE? And you'll find the instructions for this poll in the chat. If you'll take a look in the chat, you'll find it. Answering the question is easy. There is no need to actually download anything. You can use the link in the chat and give multiple responses. So I'm taking a look now to see our responses in the chat. See various responses showing up on our poll. Enough food. I see food again. Food, lots of food responses. A few more of you may be responding. All right. So as you can see from the responses, as well as from the list, it looks like most of you think that food, right, is really significant. There's also a list here that shows, in addition to food, paying household expenses, loss of jobs, etc. And so thank you all for participating in that quick poll. And so for us, this was not surprising, but the top concern of all of these was paying for housing, right? Followed closely by paying the bills per our COVID survey, paying down debt, and childcare and education. And so, you know, for almost 100 years, United Way has provided what's needed, where it's needed. And this is especially true in times of crisis. Just two examples related to the survey findings are, first, our STEP program, For those who may not be aware, it stands for Strategic Targeted Eviction Prevention. For those who've lost their income or otherwise been impacted by the pandemic. So we piloted this program earlier this year with our partners in Baltimore County government. And we were able, fortunately, to provide owed back rent to 935 households, about 2,300 individuals. Based on its success of this pilot, we were about to launch the STEP program in other counties that we serve in Central Maryland. So with eviction bans coming to an end, this program is so very critical. And we recently broke ground, as some of you may know, on our third family center, which will provide affordable, accessible childcare for parents who live or work in Howard County. This pandemic has exposed inequities that we always knew existed, but we are seeing more and more people stepping up to do something about it. And we're about to hear from some of them. We're about to hear from some of them today. And now I'd like to welcome our moderator, Caitlin McDonough. Caitlin, she will be substituting for our planned moderator, Lisa Harris-Jones. Caitlin, and we're so grateful to have her, Caitlin is an attorney, the newest partner of Harris-Jones and Malone LLC, one of Maryland's premier law firms, and they specialize in state and local government relations, as well as lobbying services. So thanks to Caitlin's leadership and Harris-Jones and Malone's work, along with our public policy committee here at United Way, truthfully, we far exceeded the expectations in the advocacy space this year. We're so delighted about that. And I'd like to point out that the services of her and her team are funded by our long-standing partner, the Seymour Institute, which has been a very strong supporter of our family stability programs since their inception. So Caitlin, we'll welcome you. Turn it over to you now. Thank you so much.
Thank you so much, Franklin, and good afternoon to everyone. Before we get started, I'd like to say on behalf of Harris-Jones and Malone, we're really proud of the work we were able to do partnering with United Way of Central Maryland this year. And I'm really excited to be a part of the panel discussion today. So thank you for that as well, Franklin and the United Way team. And I'm going to go ahead and get us started pretty quickly because we have a lot of speakers and not too long a time. As Franklin discussed, we're here today to discuss matters that improve lives for Marylanders, and we're thrilled to have a bipartisan panel of representatives from the Maryland General Assembly, including members from each of the 6 jurisdictions that United Way of Central Maryland serves, which I think may be a first for this event. I know from working personally with each of our panelists that we all have common ground in our commitment to the health and well-being of those across the state. And we're looking forward to an open and respectful discussion. And I'll ask our participants to please be mindful of that in making any comments in the chat. And now it's my pleasure to introduce our 6 panelists. I'm going to start with Vice Chair Vanessa Atterbury, representing District 13 in Howard County, Senator Pam Vital, representing District 32 in Anne Arundel County, Senator Sen Hettleman, representing District 11 in Baltimore County, Senator J.B. Jennings, representing District 7 in Baltimore and Harford counties, Delegate Susan Krebs, representing District 5 in Carroll County, and Senator Corey McCray, representing District 45 in Baltimore City. And I'm going to move us right into our questions. Again, as Franklin discussed earlier, the COVID-19 pandemic has had a significant impact on everything in Maryland, and the General Assembly's 2021 legislative session was no exception. In order to adhere to public safety guidelines, the session was almost entirely virtual, making it one of the most unusual and remarkable sessions that I've ever experienced as a lobbyist. But despite those limitations, the General Assembly introduced over 2,000 bills, many of them dealing directly with the pandemic and with correcting inequities in our state, and ultimately passed more than 800 pieces of legislation. And now I'm going to turn it to our panelists to discuss some of their personal objectives and initiatives from this past session and, get a little bit more of their insider perspective on some of the things that we were able to accomplish in 2021. I was going to start with Senator McCray. I don't know if one of our admin folks can help me to know if Senator McCray is present yet. I know he was running a little late from a previous event. Okay, I'm not hearing that he is. So I'm going to go ahead and I apologize. So Senator Jennings, you're going to be up. So our first question, again, I'll rephrase it for you, Senator, is if you could just tell us a little bit more about your experience during this unprecedented legislative session and, you know, some of the things you were focused on dealing with issues facing Marylanders in our state.
Well, thank you. Thanks for having me. First of all, I have to apologize outside where I work. I'm not allowed to have cameras, so I had to step outside, and I'm in a park, so hopefully the kids playing over here are a little quiet. So this session was, as you said, and everybody has realized, was a lot different. And the biggest issue was we worked in a vacuum. There was nobody in Annapolis other than the legislators and the direct staff. No lobbyists, no public. Many of our offices, we were short-staffed.
Senator, I apologize if I'm interrupting you. We're having a little trouble with the audio coming in. I don't know if you can hear me, Senator.
We were allowed to have in the offices. Some of our staff was at home.
Okay, so I apologize. We're having, if you couldn't hear from the beginning, Senator Jennings actually in a secure office, so it's been difficult for him to, he can't do audio and video at the same time. So I think our admin's going to go ahead and mute Senator Jennings.
To communicate with their to see each other in the hall, to talk. And that was the most unique thing I saw, and the most difficult part, because you didn't always get the.
There we go. All right. I apologize. So, okay, we're going to move on to our next speaker, and we'll try and get that audio issue resolved and get Senator Jennings back in. So Delegate Crabb.
Story you didn't get.
Oh my goodness.
The only thing I can do is turn off my video, which.
Okay. It's all right, Senator. We're going to get you straight. I'm going to move on to Delegate Krebs right now. Delegate Krebs, why don't you tell us about some of your top priorities from this past session? I know we worked with you on several major issues this session. Please go ahead.
Thank you very much, Caitlin. Well,
thank you.
I think we have a lot in common, the United Way, and strengthening families and community by increasing access to basic needs. The big issue for me is healthcare. I serve on the Health Committee, as you know, Health and Government Operations. And sometimes we get into the weeds on some of the issues, but this year we had some really opportunities because of COVID. I know we had a lot of problems, but some of those problems talked into opportunities. So our committee is a very collaborative committee. We focus on accessible and affordable quality healthcare. I'm also a former member of the Board of Education in Carroll County, so I have a great interest in education, which I'll speak about later. But when the state shut down last year, the governor was given emergency powers to do things that ordinarily would have to go through the lawmaking process. But COVID-19 forced some profound changes in the delivery of healthcare overnight. You could not, access your healthcare. So we accelerated many of the initiatives that we've been talking about for many, many years in healthcare. And the demand for both physical and behavioral healthcare soared, and providers were forced to pivot to caring for patients virtually. So we've talked about telemedicine for many years, but it was little used. But during the pandemic, they were able to use telemedicine because of the emergency powers of the governor, and the use of telemedicine soared 4,000% higher than prior to the pandemic. It was a huge ramp up. People were able to access their doctors from the safety and convenience of their homes, from their place of work, and wherever they were. But when the state of emergency ends, which is going to end soon, we have to pass legislation to allow this to continue, because that was just temporary. So we were very proud, our committee, of the work we did together to pass the Preserve Telehealth Act of 2021, which is going to change the game for modern day healthcare delivery and cement into law what was a lifeline for patients during the shutdown. especially when things like medication use stabilization was needed for diabetes. Over 50% of the use of telemedicine was for mental health and behavioral health services. As many know, we had a 12% increases in overdoses during the pandemic. So we really need to make sure we have access to care. But this legislation took a lot of time to put together, but it's going to improve costs and outcomes, and we hope costs less. It's going to cause less time off needed for people that are working. It's going to remove transportation barriers for people. And it's just another delivery tool that we're going to have for healthcare in our pocket. However, there were more pronounced disparities because of COVID. And one was some of the obstacles that were there to deliver telehealth. And it had to do really, instead of racial or ethnic or gender disparities, it was more rural versus urban and middle income versus low income with regard to access to broadband. You can't have telemedicine if you don't have broadband. And actually in telemedicine, the Medicaid population actually mirrored the general population with regard to telehealth use. So it was it was used by both. So we believe that the use of telehealth will promote equity and create opportunities and improve lives for everyone. But we do need to look at bridging the digital divide, because broadband is now like the day when electricity and phone lines became universal. We need to treat broadband high-speed internet like a utility, because over 300,000 Marylanders are still lacking access to broadband. So we'll be working on that in the interim. I think the governor put it in his budget. We passed it in his budget. We put $300 million in the budget, and some federal money came with that to fund broadband projects throughout the entire state. And we created a new expanded IT department to help the local jurisdictions with the expansion of fiber in all communities. So we've done that. And one quick other thing we did is continue to fix our 211 non-emergency helpline, which basically we set up a number of years ago. And the United Way has been really helping us let people know that we now have 911 for emergencies, and we have 211 for non-emergencies that give us access 24/7 to talk to real people about essential mental health and behavioral health services, addiction services, housing needs. And we just got to get our folks educated that there's another service out there called 211, and educate people as to when they would dial that versus our 911. So we had some legislation regarding expanding the services of 211 as well. So thank you.
Thank you so much, Delegate. I know access to healthcare and other essential services is key to all our Marylanders, but it's really exciting to hear that the General Assembly's taken what I think was a challenge during COVID and made it kind of an opportunity to bridge gaps and increase access going forward. So thank you for that. And keeping a little bit, I think, in the same vein of access to services and protection of essential services, I'm going to turn now to Senator Vital. Senator, can you please tell us a little bit about your accomplishments from the 2021 session? Just give Senator Vital a second.
There we go. Thank you.
There we go.
I have my document up and couldn't unmute at the same time. So thank you to the United Way and for your ALICE report. I know that you do a lot serving Anne Arundel County, and I really appreciate the work of the United Way. I serve on the Finance Committee, which includes healthcare policy as well as banking, energy, insurance, unemployment, and workers' comp. So we had a really busy session this year and focused a lot on the healthcare, telemedicine, and health equity and behavioral health. But serving as one of the Senate appointments on the Oversight Committee for Nursing Homes and Assisted Living Facilities for the past 2 years has helped me to understand the need for careful care for our seniors. 6 million people in the United States are currently diagnosed with Alzheimer's disease. Specialized memory care units are designed to take care of these folks. However, we learned that current regulations do not require much of these special units that typically charge higher rates. More training is needed, more supervision, and trained therapists to keep them engaged. My Senate Bill 204 requires that assisted living regulations be updated. They've been sitting on the shelf since 2016. And in those updates, it needs to include specific training for memory care units and sufficient staff to meet the needs of the patients. On another issue we worked on, December 23rd, 2020, the Washington Post printed a story about nursing home in Eastern Shore that had transferred ownership to an investment company. Care in that facility quickly went downhill, and the staff was cut. Staff was required to come to work even with symptoms of COVID, and they were without hot water. The staff was purchasing cleaning supplies from local retail stores. 74 pages of violations were issued from the federal regulators and almost as many from the State Office of Healthcare Quality. So Senate Bill 704 addressed nursing homes that are transferred for companies that have not operated in Maryland before, and requires the first full survey and inspection to be done within 3 months, not a year, and that an unannounced visit will happen 120 days later. Senate Bill 507 from Chair Kelly was really an important bill that addresses assisted living that take over the finances of their patients. And so now the Office of Healthcare Quality will have to register and notify the Division of Consumer Protection any assisted living program that's acting as a resident's representative and payee. As you know, these folks in assisted living very often do not have their own voice to share. So we're going to keep a closer eye on those finances. With 1,900 assisted living facilities in the state, there's very little oversight on these small facilities. And finally, Senate Bill 550 was my bill to address behavioral health services in a matching grant program for service members and veterans. It established and creates a matching grant program for up to $2.5 million a year in the state budget to help with behavioral health services for service members. So that's my update, and thank you, United Way.
Thank you, Senator. We know that both seniors and veterans are important facets of the ALICE population that United Way serves. So we thank you for ensuring that there's proper protections and opportunities for members of that kind of vulnerable group. So thank you so much. Now, before I turn next to Senator Hettleman, who I know was very involved with housing and eviction prevention during the session, an issue that is paramount to our work here at United Way, I wanted to note that the governor did extend the eviction moratorium beyond the original end date of June 30th out to August 15th. So while that affords some families with access to housing for a little while longer, thousands of Marylanders will still be at risk for eviction when the ban is eventually lifted. And I note that because it brings us to our next polling question for the audience. So I'm going to once again direct you to the link in the chat, as you did with Franklin earlier, to answer the following question. What percentage of Maryland renters would you guess could be facing eviction when the time comes? I'm going to give folks a little while to answer the question. And again, you can just go ahead and click. Look, you guys are faster with this one this time. So, all right. And we can see those information coming in. And it looks like the vast majority of you are correct in that the answer is 21%, or about 200,000 renters, which is a huge number of people, including many families with children who could be forced out of their homes very soon. And I'm going to noting that data and that reality that we're facing here in Maryland. I'm going to turn now to Senator Hettleman. Senator, please tell us about your work in Annapolis earlier this year, excuse me.
Thank you so much, Caitlin. And I want to say thank you very much to the United Way. As a representative of Baltimore County, Franklin mentioned the important STEP program that has prevented many 900 plus households from being evicted. That was really a focus of this session. We had success in passing House Bill 18. I had the companion bill of the Senate bill, which did not get through, but that bill would provide counsel to people going through eviction proceedings. We know, and you spend so much time, many of the people on this call, on preventing evictions. Evictions aren't only a symptom of poverty, but also a cause of it. And when you lose your home, you lose your center, your possessions, and it has ripple effects on everything else in your life. Your ability to hold a job, to apply for a job, to keep your children in school, to keep yourself and your kids in good health also. And there's a reason that the public policy approach, both at the federal and now at the state level, to homelessness is now called housing first. It's because we found that once someone has stability in their own home, then they can work to address other issues that might be going on in their life. But what we're facing now, in addition to the folks who were struggling with housing prior to the pandemic because of our lack of supply of affordable housing, and the fact that housing costs have risen over the years without a corresponding increase in wages, is that we're on the cusp of having a whole new class of people being evicted. And many of these folks are the ones that have been working, who are finding themselves newly unemployed and have fallen behind on their rent. We're also finding that landlords sometimes have been using the pandemic as a way to get people, so-called problem tenants, people who might be complaining about the condition of their housing and want something fixed, or they might be trying to organize other tenants to advocate for better housing as a way, this time as a way to get them out of housing. The Right to Counsel bill, the reason that we put it forward was that 96% of landlords are represented currently by a lawyer or an agent going through the eviction proceeding in courts, and only 1% of tenants are. And in localities where they have right to counsel, and we're the second state to do it, but in cities where they've been doing it, they found that if somebody is represented, that it avoids disruptive displacement in about 92% of the time. And that is critical to keeping people in their own homes. So that bill was allowed to go into law, will take effect on October 1st. It also has a really important provision in it that will allow a 10-day notice to tenants before a landlord can file for eviction. So that will enable tenants to have a little more time to get their defenses together, to seek counsel, and to be more organized before they go into court. We had a number of other bills. I'll just mention two. One was allowing a 60-day notice for non-renewals of lease for tenants. So again, that they can have more time to plan. And a third one was one I filed along with my colleague in the House, Delegate Julie Polakovich-Carr, to create a reusable tenant screening report to save tenants money, the filing fee, and some screening ability for landlords who are willing to use it. It's sort of like the Common App in college application process for finding rental housing. So I'm really happy to talk more later or answer any questions that you have, because there were a number of housing bills that unfortunately did not get through to. I'll turn it back to you, Caitlin. Thank you.
Thank you so much, Senator. I appreciate that. And now next we're going to move, and obviously I'll note before I move on that housing, as we mentioned, and housing policy is critical to our work at United Way. So we really appreciate you touching on all of that kind of aspect and the role that the General Assembly is playing in correcting some of those issues in Maryland. Next, I'm going to turn to Delegate Atterbury. Delegate, please tell us about your proudest moment or one of your proud accomplishments from this past session.
Thank you, Caitlin. And I also want to thank the United Way. I want to thank the President and CEO, Franklin Baker, for having me here today. And I want to say that I'm particularly excited representing Howard County and being born and raised out here, that there is a family center out here now. I know the importance of childcare, having 3 very little young people myself, and going through the throes of the cost of that and how difficult it is for a working parent. So I appreciate all your efforts in that. So I'm going to just pivot for a couple of minutes and talk to you about what I really focused on this session, which was police reform. And the Maryland General Assembly passed sweeping police reform this session. And the House began that effort in May, right after the murder of George Floyd, when our Speaker of the House appointed me to chair our work group on police reform and accountability. And so that work ended in October, and our recommendations moved on to the House of Delegates. And then we in turn worked with the Senate and passed reform through the General Assembly. So I'll hit some of the highlights, because I could talk about this for forever, because I was in the throes of it for so long. So Caitlin, please feel free to cut me off. I'm trying to monitor my time. But kind of some of the big buckets that we did, we repealed the Law Enforcement Officers' Bill of Rights, which is interesting because it started here in Maryland in 1975, and we were the first state to repeal it. And what we did was replace it with new accountability measures that incorporate citizens in the process and incorporate a database and individuals to help folks who file complaints against an officer know where they are in the process with that complaint. We mandated body cameras throughout the state of Maryland, because that was not the case. It was not the case here in Howard County. We did not have them, I was surprised to learn. And so there are different deadlines depending on the size of the jurisdiction to allow those localities to in fact purchase the body cameras. We mandated independent investigations where there has been a police action resulting in death or serious bodily injury. So we're saying, look, the police cannot investigate themselves in this situation. The new unit was created under the umbrella of the Attorney General, who will be working with the state police who have barracks in each jurisdiction, who can quickly respond and work with the locals on that scene. We also created a uniform use of force statute throughout the entire state of Maryland. Maryland has 148 different police departments. When you look at the county, different counties, Baltimore City, the different localities, and your what am I trying to say? Your University of Maryland and such. So we said, look, everybody should be operating under the same umbrella in terms of use of force, and everybody should know what to expect. And finally, we passed legislation that says that a police officer's files are not personnel records, and therefore they are discoverable. And so you can see if a police officer has been a bad actor. I just want to briefly touch upon some little nuggets that don't get talked about a lot, but that are incredibly important that we did. One, we instituted a scholarship and loan repayment program for individuals who commit to a police department in the state of Maryland to help recruitment. And we also instituted a confidential employee assistance program. So if a police officer is experiencing any type of crisis, that they can confidentially go to the employee assistance program and seek help. So we really passed some amazing things. I like to tell people after we did it, Whoopi Goldberg on The View said everyone should follow Maryland's lead. So we all should be really proud. Thanks, Caitlin.
Thank you so much, Delegate. And I know you are critical to the passage of that legislation and development. So it's exciting to have you here to discuss it. And I think Senator McCray has joined us. So we're going to squeeze you in real quick, Senator, before we move on to the next portion of our event. So Senator McCray, please tell us a little bit about the work you did this past session. I'm going to cut you to 2 minutes.
Yep. Thank you, Caitlin, and thank you for this opportunity. One of the things that I think about is just around housing. And when we lift up housing, we know, Vanessa, that affordable housing isn't an opportunity that's there for everyone. But during this legislative session, we were able to help groups like NEHA, Northeast Housing Initiative, one of the 3 land trusts that we have, working in the 4x4 neighborhood. We were able to work with St. Ambrose Housing because in the 4x4 neighborhood, Caitlin, they have 600 homes, but 150 of them are vacant, dilapidated, and making sure that we can bring groups in there that will be very intentional, that can make sure that affordable housing is being provided to the families that need it the most, and keeping the core of Baltimore is so important. So that's one of the things that I'm thankful for, is just around this housing piece and how we can close that gap and make sure that we can create generational wealth.
Very good and very timely. Thank you, Senator. And as you, first of all, let me pause a moment and thank all of our panelists for their answers to that first question. I think we have a good sense of all the different types of work and different issues that we focused on this session, both tied to the pandemic and beyond that. United Way supports equity for all, and it's so great to see leaders illuminating and elevating equity, and it's exciting to hear all the work that each of you are doing. Now, again, I think we've said this several times, but the pandemic has touched every facet of our lives, but we know that a lot has been done to address the inequities that probably were heightened because of the pandemic, but there's still more to do. And a lot of that will involve policy and legislation and work by our legislature. And I think that brings us to our next and final question for our audience. So I'm going to once again direct you to the chat. This question's a little bit different in that it's an open-ended question. So we want to ask our participants that after hearing from all the panelists and some of the work they've done in the 2021 legislative session, what issues are most important to you? And I am going to give them because this is open-ended, I'm going to give our audience members a little bit of time to answer. And I think a lot of these probably not be entirely surprising to some of our legislative leaders. We're seeing childcare, which is what I would put if I could type and talk at the same time. And affordable housing, equity, housing and job security, childcare again. Give folks a chance to get some answers in here. And I know a lot of these are kind of matching up with some of the issues that our panelists have already discussed. And just so you know, in our next portion to kind of wrap up our discussion, we've talked a lot about what's already been done, but we wanted to have our panelists have this opportunity to see where our audience focus is, so that based on these responses and their own experience as policymakers and representatives, that they can discuss going forward a little bit of what they plan to do in 2022 and beyond to address equities and help serve Marylanders across the state. All right, so I think these answers are going to keep coming in, but and so we can keep noting those, but I'm going to start turning to our panelists for round two. And I'll warn you, Senator McCray, you're up first this time, so you got back to back. So that's what you get for being late. Now, so for this, I'm going to rephrase the question for everybody. So, and we've discussed a lot about what we were able to do in this session, and I'd like to hear from our policymakers what issues and actions are most important to you going forward into the next session. If these are things that can be accomplished by legislation, what perspective do you see there? And what do you think will be the most critical legislation you foresee in the 2022 legislative session that could impact Maryland families and individuals? So we're going to try and keep answers to about 2 minutes to close this out. And I'm going to try and go in a similar order as our first panel, but I'm going to start off with Senator McCray. So based on what you see here and your experience, what are your goals and objectives for next session, Senator?
Thank you, Caitlin, for that opportunity. The thing that I think about the most is the Transportation Safety Investment Act. When we think about public transit, we have to remember that our students catch public transit to go to school. We have to remember that our seniors catch public transit to be able to get prescription drugs or doctor's visits. Our families catch it to get healthy food options. So single mothers, single dads, workers catch it to get to work. Caitlin, the reality is that many of us may have a car or a truck, but there are a large percentage of Marylanders that do not have that luxury. And we have to make sure that we're maintaining the core functions of our bus system, our light rail, our MARC, our subway, and making sure that they're not breaking down, making sure that they arrive on time, and making sure that they're reliable for everyone that wants that opportunity. And I hope that that's one of the first things that we take up during the 2022 legislative session. Thank you again.
Thank you, Senator. That's a great answer. And we're going to turn next, and I think we've got our audio issues resolved. So I'm going to turn next to Senator Jennings. Just to I know you kind of got cut off earlier because of our technical difficulties, but if you can just touch a little bit on your priorities and focuses going forward into the rest of 2021 and 2022, Senator Jennings.
Well, thank you, and sorry about the problems I had earlier, but that is a snapshot of what thousands of school children dealt with this past year with regards to internet and not having broadband. And I think that's the big one for me is, you know, we all kind of have our own issues in for my area. And I know Delegate Crabb, where she represents out in Carroll County, you know, internet connection is important. It's considered I consider it now a utility, just like phone and electric. So I think making sure we get broadband and connectivity from Ocean City to Oakland, Maryland, is important because there's thousands of students that lost out on their education this year because they could not connect. They had the same exact difficulties I had a half hour trying to talk to you all. That is a big issue that is very important that I think should be corrected next session.
Thank you, Senator. I appreciate that, and I agree. I'm going to move on now to Delegate Crabb. Delegate Crabb, tell us a little bit about what you hope to focus on going into next year.
Well, it's not just focused next year, but it's really focusing. I've been focusing on it this whole last 6 months, and it basically has to do with education. And it's sort of time to look to evaluate what we did in our actions and say what would we do different. And obviously, throughout the nation, different states handled this differently. But I believe that we didn't follow the science as much as we should have. Back in as early as February or early on, basically they said that school age attendance is not the primary driver of community transmission, and students were very safe being in school. And mortality rates, it's actually it's more chance of being hit by getting killed by a transport accident going to school by 15 times more the mortality rate than kids dying from COVID. So we need to really look at what the decisions we made were not necessarily made based on the science that came out report after report. We were late to pivot. So given that, that all is connected to childcare and reopening schools and going to work. If you don't have your kids in daycare or your kids can't go to school, you can't go to work, especially for our essential workers, our frontline workers. Not everyone can work at home with their kids on the computer. So I believe that our schools were closed for too long, and school systems across the nation were successfully reopened, many since September. And more low-income people are in public schools, more middle-class people are in public schools, but many people who could afford it ended up pivoting and sending their children to private schools. So they got to continue to get the benefit of education. And education is the key for our students, and it's also the way that we're going to get folks back to work. You can't go back to work if you don't have care for your children. So I think we MSD actually put out a document. I've hold it up here, and it's called Meeting the Challenge, Maryland's Early Learning Response to COVID and Readiness Matters report. And hopefully all the school districts in this interim, starting, when we go back to school in the fall, have a plan to recover all of this last year, that our children, not just academically, but also the mental health of some of our children has really been affected. So we really got to figure out how we're going to get our kids back on track, especially those who are most at risk. So that's what I plan to continue to work on, not just in the session, but every day as we move forward.
Thank you, Delegate. I mean, I think we recognize at United Way that one of the inequities that's major in the state is in education and access to quality education, and the role of childcare in the vulnerable families that we focus on, and mine is essential. So we appreciate your work on that. I'm going to move next to Senator Vital. Senator Vital, coming out of this session and headed into next year, what are you looking to focus on to kind of help with the recovery and getting services to our families?
Thank you, Caitlin. And as you know, I represent an area that has a couple 100,000 jobs. NSA, Fort Meade, the National Business Park, all the companies on West Nursery Road. So I'm really going to focus, and I'm already starting to focus on the transportation issue. And as Senator McCray said, we are concerned about the current transportation system, the safety and reliability, but we also don't provide enough transportation for the right times. If you work at BWI Airport, you need to be there 5:30 in the morning to open your kiosk. If you work at Maryland Live, you might get off at 1 o'clock in the morning. My employers can't get enough people to work because of transportation. So if we want to lift people up and their the cost of living for them, provide better income and food security, we really need to provide good jobs. And I think we can do that through workforce training, that we passed a lot of legislation this year about workforce training and the blueprint, and in grants to our workforce development offices, but also to be able to provide transportation. So I'm working with Senator Malcolm Augustine. We have some meetings coming up to really look at mass transit in the state, including our trains. We need to provide better train transportation, and that's really going to be my focus in the upcoming session. So thank you again.
Thank you. And thank you for being here, Senator. All right, I'm going to move next to Senator Hettleman. I know, Senator, you already touched when you were speaking earlier on a lot of the things that the state has been able to do, but that there's still a lot more to do relating to housing and some other inequities in the state. So, please tell us, give us a glimpse of your plans for next year.
Sure. It's actually already in the works because at the beginning of the hour, Senator Cardin spoke about the amount of money that was coming into Maryland as a result of first the CARES Act, then the American Recovery Act, and so much of that money, over just under $800 million, is going to be focused on eviction prevention and housing. And so Senator McCray and I and a couple of other House members were part of an oversight work group to work with the Department of Budget and Management and the Department of Housing and Community Development to come up with some parameters for how that, of course, within the federal guidelines of how that money should be directed, and some of which is going to the United Way through the STEP program. I'm very excited to see that you're going to be expanding beyond Baltimore County and helping other counties to get that money out the door. One of the concerns is that there are nearly 200,000 households now behind on rent. And with the courts just having opened in mid-March, there are still an enormous backlog of cases waiting to be heard. In Baltimore County alone, it's just under 54,000 cases. So the courts are now in full swing, but they're still dealing with eviction proceedings from pre-pandemic. So we're talking 2020. So people who are whose landlords have filed evictions against them are not that are pending in the courts now are not going to be heard for many months. And the concern is what happens to them. The resources are available to be able to help make landlords whole with rent or a year's worth of rent. But if somebody owes more than a year, what happens then? And so looking at housing stability as well as the lack of affordable housing is something that I will be focusing on as well. And the concern also about an increase in poverty. My staff was participating in a food insecurity workshop this week and found out that we estimate in Baltimore County a 10% increase in poverty. And so that's really concerning coming out of this pandemic and kind of looking at the safety net that exists for the most vulnerable among us. I just want to say too, we work together. None of us gets anything done alone. And so I'm just really happy to be here with my colleagues from the House and the Senate because we're all in this together and really work collaboratively. So thank you.
Thank you, Senator. That was nicely said. And we're going to, Delegate Atterbury, I'm going to ask you to close us out with a little bit of a glimpse on and I'll adjust what I've been saying, what you're working on now, going into the interim, and then also going into 2022 in that session. So thank you, Delegate.
Okay, thank you for having me again. So serving on judiciary, my focus generally lies in violence against women, domestic abuse, child abuse, that type of thing. We're going to continue to work on police reform specifically, and we've started working on this already. Who responds when there has been a call for service that involves someone with developmental disabilities? And actually who, and I'm helping someone now in Howard County, who should prosecute, if anyone, those individuals for trespassing and the like, because that is a serious problem and a serious concern. When we talk about violence against women, I just want to mention was very happy that we were able to override the governor's veto on my bill that required background checks for all rifles and shotguns, because particularly in the era of COVID, we have isolated individuals, we have a lot of intimate partner violence and a lot of increased mental health challenges. And so background checks was very important. Finally, I'm going to focus on paid family leave, which I saw was a concern. And that's a particular concern for individuals in my district in Howard County, where we have a very high population of ALICE identified individuals, and ensuring that individuals can take care of their families if there is an emergency with a parent, a loved one, a child, and that they won't in fact lose their job. And so that is something that I will help try to usher through this last session. So again, thank you very much for having me.
Thank you, Delegate. And I want to thank all of our panelists for their time and their answers today. We really appreciate your commitment to Maryland. And it's been so nice for us to have this opportunity to have an insider's look at the work you do in the legislature and be able to share that with some of our partners here at United Way. And I'll also go ahead and thank all of our audience for attending and actively participating in our discussion today. I know Franklin, I think, noted at the beginning or one of our administrative folks that this was recorded. So if it's something that you want to be able to access again or share with other partners, that's something I think we can make available on our website. And also we're showing now the contact information for each of our panelists. So if you have questions that you want to ask or questions that weren't answered by their discussion today, you can use this contact information to reach out to those panelists directly through their General Assembly emails. So thank you very much for having me. I've learned a lot and enjoyed speaking with you today, and I'm going to turn things back over to Franklin to close us out. Thank you.
Caitlin, I wholeheartedly echo your thanks for our esteemed panelists. And on behalf of United Way of Central Maryland, we really appreciate all that you are doing to literally roll your sleeves up and improve lives for people across Central Maryland. And at United Way, we fight against inequity, and we fight so hard for expanded access to basic needs every single day. And your support of United Way's Equity and Social Justice Fund will help us to do a few things. It will help us to really fight discrimination and injustice in our region. It will help us to address inequities in our United Way neighborhood zones, which are really, really important. It will help us to ensure educational equity for all of our students, as well as fund so many different organizations that are focused like a laser on addressing racial inequity. So be sure to look for information in our next upcoming Realities of Inequity sessions. Thank you all again so much for being here today. Have a great day. Enjoy this beautiful weather, and we'll talk to you soon in an upcoming Inequity series session. Thank you so much for joining today.